Hello, I'm Dr. Marla Shapiro, and I'm a past president of the North American Menopause Society. And today I'm joined by somebody who's not a stranger to the NAMS community, Dr. Cassandra Schufelt, and I'm going to ask you to introduce yourself to our audience.
Hi, well, I'm Dr. Cassandra Schufelt. I am the immediate past president of the North American Menopause Society, and I am professor and chair of the Division of General Internal Medicine at Mayo Clinic in Jacksonville, Florida, as well as the associate director for women's health research at Mayo Clinic Enterprise.
So, no one better to speak to you about this new non hormonal position statement that NAMS has. So, this isn't the first position statement that we've had. Talk to me first about why it's important that we do have a non hormonal position statement.
So this really parallels what we came out with last year, which is the hormonal position statement, right? So I think we need the non-hormonal position statement so that women who can't take hormone therapy or don't want to take hormone therapy, personal preference, they have options and don't have to suffer in silence. And it's a vetted way that an expert panel can really come together, dive into the literature since the last publication, and provide guidance for those that are interested in using non-hormonal treatment on what is the science has shown and what is recommended, as well as not what is not recommended.
I think that's so important because depending where you are in North America, some of these medications are considered off label. So let's look at what's new and updated from our previous statement, which is now at least 8 years old. So, what is the new research telling us?
Right. Well, you'll find that the new statement, the 2023 statement, while it is 8 years, an update over the last 8 years, a lot of it does still ring true in terms of lifestyle changes and in terms of other medications that we found. But there are really some significant changes specifically to the prescription therapy options that are available. And what has really changed is that we still are recommending the class of medications, SSRIs and SNRIs, off-label use for all except for one, as well as gabapentinoids, or gabapentin specifically. But the changes to that section is that as an expert panel, we reviewed and are no longer recommending pregabalin.
Mhm.
Pregabalin comes with a lot of side effects that could include weight gain, as well as we felt as a panel, this is a medication that is under a controlled substance. So we really looked at that data in terms of else is available, but it's decided currently that there's really no reason to be recommending that medication as opposed to other medications that are there. The second medication that has been changed that we're no longer recommending is clonidine. And clonidine, as an expert opinion, we felt that there were better options from the prescription therapy option guidelines that have really changed the recommendations. We're no longer a society and position statement recommending that medication as well.
And the concerns associated with clonidine?
Clonidine can actually cause some changes to blood pressure, and so that was one of the reasons, as well as the literature was pretty old in terms of what was recommended. So that was another reason that came down to that decision. What's more exciting is that a new medication has popped up onto the prescription options, and that is oxybutynin. So this is the medication that is now kind of another option for women to trial. Really, clinical trials have shown in a really significant drop in terms of therapy for non-hormonal treatment with oxybutynin for hot flashes. So that's exciting.
So, things that we're often asked about, and I'm sure you're asked about this all the time, are about supplements. Is there any data that supplements will help? Should women be using it? Are they using it without data, but it is no harm at the very least? It remains confusing.
Yeah, it does remain confusing, but similar to the 2015 non-hormonal statement, and really given the lack of rigorous evidence-based research, we do not support the use of any over-the-counter supplement or herbal therapies for the management of vasomotor symptoms, and these remedies were not recommended at the end of the panel. We did a thorough evaluation on what was new, what had been out there, and what had been studied, and so that was our conclusion in terms of you can save your money. No over-the-counter supplements are really providing more support above the placebo rate. And more interestingly is that the new to that section on supplements and herbs is cannabinoids. So cannabinoids are being used by women, and they're used by women for a tremendous amount of different things. But when it comes to the science on the treatment of vasomotor symptoms, we are not recommending the use for vasomotor symptoms.
Okay. And in terms of lifestyle and where the data sits on lifestyle itself, so whether we're looking at meditation or paced respiration, or avoiding triggers or cooling agents, there's so much out there that's in the lay literature that our patients bring to us. Where do we stand in terms of any of that being evidence-based?
Yeah, so again, this is another area that really does parallel what was found in the last statement, is that there's really no strong evidence that lifestyle changes such as cooling techniques, avoiding triggers, improve vasomotor symptoms, and there was insufficient evidence to support the use of exercise and yoga. Now, at the end of the day, if this is working for your patient, this is just to provide that there's no scientific evidence. So it doesn't mean that you wouldn't recommend them, especially for other things like exercise we want to use for obviously for overall health, but we didn't find insufficient evidence to recommend them specifically for vasomotor symptoms. And we recognize that a healthy diet is important for health promotion and chronic disease prevention, but there was really limited evidence to show that dietary modification was really improved hot flashes and night sweats. But we did see that weight loss may be considered for improving vasomotor symptoms. So that's the one that really did stand out in that section for in terms of lifestyle changes.
And when we look at the future of non-hormonal treatment and why it's important for NAMS as a society to include these medications and these approaches, what do you think the future will take us to?
Yeah, so that's a nice section that we added to this statement. We know that there are new medications that are coming up into the pipeline and that are going to be coming up in front of the FDA or have already been coming up in front of the FDA. So this is where we have a specific section on the future of these medications, and it is a pretty exciting time. The future is the neurokinin B antagonists, and while they are not FDA approved yet, or they are going to be coming up to be reviewed for approval in 2023, they're under development for the management of vasomotor symptoms. And I think this is where the science is really showing us what a vasomotor symptom is and how we can actually get at the root of it. But while they are not FDA approved, we do want to make sure that that's being labeled appropriately. So we don't have a statement whether or not we approve of these or we recommend them yet, but we did have a section dedicated to this science.
And I think it's so important as a society to stay ahead of the research, not necessarily endorsing until all the research is out, but the evolution of what we're learning in terms of what causes a hot flash and what different triggers can be and how we might target that in terms of medication that are not hormonal in nature.
That and as well as the safety. I mean, you said
Yes.
it at the very beginning, we need to think about things that we're recommending and whether there's long-term or short-term safety, whether it's the supplements or the medications that we're recommending.
And I think it's so important to have made that distinction between the gabapentins and the pregabalins because we think of them as being similar in nature, but certainly in terms of the side effect profile and the usefulness of this for specific hot flashes, not neurological indications, there is such a clear difference.
Yeah, agree completely.
So very exciting to have this position statement that's out there for us to reach to. It just expands our options and really allows us to approach all women in terms of their preferences as well. Thank you so much for joining us.
Thank you for having me.